there, Heather Thompson with Core Mobility Fitness. We are going to talk about breathing today, and we're going to talk about it, and we're going to practice it lying down. So breathing is really important to get the biggest inhale and the most expansive inhale, as well as getting all of the air out of our lungs when we exhale. Now, a lot of times with stress, if we are a new mama, we have postnatal stuff going on, if we are pregnant, lots and lots of obstacles, then we don't actually get a full breath. And we don't actually get a full breath and get all four sides of our body working and expanding. And if we don't get all of the air out, then we can have all kinds of issues. We get a lot of tension in our shoulders and our neck because all of our smaller accessory muscles are working to do our inhale and exhale. We're not actually getting our diaphragm and pelvic floor to work together. Then we can get a lot of tightness in our back. We can get tightness in our abdominals. We can clench in our glutes. There's all kinds of stuff that can happen if we don't get our proper breath. So lying down, when you inhale and when you exhale, you really want to think of a 360 breath pattern. So when you inhale, you think of your back really, really expanding into the mat, your sides and ribs really expanding out to the sides. Your belly's going to go too. Please don't think about keeping your belly button in towards your spine all day. It really needs to expand as well, so that breath comes all the way down into our pelvic floor. The diaphragm and pelvic floor work together. That's for women and men both. We all have a pelvic floor. So you're going to inhale for as long as you possibly can through your nose. And then when you exhale, start your exhale low, so you push the air out from below that belly button, and then as you're exhaling, you're going to squeeze the ribs, and then as you exhale, feel down here into your sides. Can you feel that exhale in expansion and tension in your internal and external obliques, as well as everything pulling in and together? If you can't, if you have a big bulge here in the bottom of your belly, it means you're pushing the air down as opposed to exhaling and pushing the air out of your body. We want that air to go out of our nose, out of our mouth. We don't want to push it down because that means it's going to give too much pressure to our pelvic floor. We can cause hernias in our back. You can have pelvic floor issues, prolapse. If you're trying to heal a diastasis recti after pregnancy, it's going to increase that DR as opposed to heal it. So you really want that inhale to be a nice 360. Your exhale starts low and it closes, closes, closes. So you can take arms overhead to do the inhale, just to kind of release through your lats as well. So you're going to inhale into your back. And when you exhale, and when you exhale fully, you may exhale into a cough. You may just automatically expand again, but practice that at home. It'll be good anyway just to take a little bit of time, especially in this time when we've got so many things going on. So really just inhaling as big as you can and then exhaling as much as you can. Good luck breathing.